Okay, today I'll be talking about calcium channel blockers. The two that it focuses on is amlodipine and nifedipine. The patient history that I went ahead and I did was Mr. Brown. He's an overweight 58-year-old African-American male, comes into the ER, complains of chest pain, a headache, and having some difficulty breathing. Patient history is obtained which is when it was discovered. Since the pandemic, he has been working from home and he has not gone out much at all. He used to get out sometimes, but because of the pandemic, he lives a very sedentary lifestyle. He states he gets very overwhelmed and stressed at work, and it has only gotten worse since he has started working from home. It is also discovered that hypertension runs in his family. After obtaining vital signs from the patient, it is discovered that the patient has a blood pressure reading of 149/94. The patient is educated that his blood pressure is in the pre-hypertensive range and could lead to serious cardiac issues if it is not controlled. The patient asks what can be done to control the hypertension and lower his blood pressure for his follow-up. We recommend the patient becomes more active, changes diet, and tries some breathing or meditation exercises to help relax and help with the stress from work. The patient is scheduled for a follow-up appointment for 4 weeks. Blood pressure will be reassessed and assess changes in lifestyle. At the follow-up appointment, the patient had his blood pressure taken at 3 different occasions to ensure accuracy. The first time his blood pressure is taken when he checks in, the reading was 146/92. The second reading when he gets into an exam room, and that reading was 152/96. And then the third reading was taken when the doctor comes in to assess the patient, and the final reading was 148/93. And so the trade name for amlodipine was the Norvasac, and then nifedipine, it's going to be those four right there: the Adalat CC, Epiditab, CR, Procardia, and the Procardia XL. They're both going to be in the same pharmacologic class, calcium channel blockers, and then they're both going to have the same therapeutic class. They're used for anti-anginal and antihypertensive. The mechanism of action for both of them are right here next to each other so they can be compared. The amlodipine, it's going to bind to a dihydropyridine and a non-dihydropyridine. The cell membrane receptor site on myocardial and vascular smooth muscle cells, and inhibits influx of extracellular calcium ions across slow calcium channels. This decreases intracellular calcium level, inhibiting smooth muscle contractions and relaxing coronary and vascular smooth muscles. It decreases peripheral vascular resistance and reduces systolic and diastolic blood pressure. It's going to decrease the peripheral vascular resistance also, which is going to decrease myocardial workload, oxygen demand, and possibly angina. Also, by inhibiting coronary artery muscle cell contractions and restoring blood flow. The nifedipine, that's going to slow movement of calcium into the myocardial and vascular smooth muscle by deforming calcium channels in cell membranes and inhibiting ion-controlled gating mechanisms and disrupting calcium release from sarcoplasmic reticulum. This is going to decrease the intracellular calcium level, and it's going to inhibit smooth muscle cell contractions and dilate arteries, which decrease myocardial oxygen demand, peripheral resistance, blood pressure, and afterload. They're going to mostly have the same therapeutic action and indication. The amlodipine, it's going to manage hypertension. It's going to treat chronic stable angina and vasospastic angina. And it's also going to treat angiographically documented coronary artery disease, or CAD. The nifedipine, it only has one less than amlodipine, and it's going to be manage hypertension and manage chronic stable angina. So the only one that it doesn't do is going to not treat the CAD. For the adverse effects, these are both going to be very similar as well, since they're in the same class. The amlodipine, the common side effects are going to be flushing, palpitations, peripheral artery or edema, abdominal pain, nausea, dizziness, headache, fatigue. And the serious are going to be acute myocardial infarction, angina pectoris, and angioedema. For nifedipine, the common are going to be hypotension, palpitations, peripheral edema, flushing, nausea, dizziness, headache, feeling nervous, cough, and dyspnea. The serious are going to be myocardial infarction, ventricular arrhythmia, GI obstruction, or GI ulcer. The nursing interventions are going to be administer medications orally, monitor for orthostatic hypotension and other adverse effects at regular intervals, especially for the at-risk patients, which are going to be the older or postural symptoms. Monitor for improvements or maintenance of blood pressure to indicate if medication is effective. Assess patient's pain level in relation to angina. And then you're going to monitor for signs of decreased cardiac output and response, including a slow heart rate, hypotension, dizziness, and headache. The priority teaching that you would go ahead and do with the patient. Okay. Patient should avoid activities requiring coordination until drug effects are realized because the drug could cause dizziness. This drug may cause palpitations, peripheral edema, fatigue, headaches, abdominal pain, nausea, or flushing. So you need to make sure that you tell them the side effects that are not expected, but that could happen. Advise patient there are multiple significant drug interactions for this drug, so they need to consult healthcare professionals prior to new drug use, including over-the-counter and herbal drugs. Instruct patient to take missed dose as soon as possible, but if it's been more than 12 hours since the dose was missed, skip the dose. Tell the patient to not eat grapefruit or drink grapefruit juice, while taking this drug. Okay, and then time for the quiz. Which of the following is an adverse effect of calcium channel blockers? A, flushing, B, diarrhea, C, constipation, D, tachycardia. And the answer is A, flushing. What are calcium channel blockers used for? A, Alzheimer's, B, hypertension, C, hypotension, or D, depression? It's going to be B, hypertension. Which medication is considered a calcium channel blocker? A, donepezil, B, ordovidin, C, amlodipine, or D, Advil? The answer is C, amlodipine. What foods or drinks should the patient avoid while on these medications? A, apple juice, B, bananas, C, leafy greens, or D, grapefruit juice? The answer is D, grapefruit juice. How are calcium channel blockers administered? A, subcutaneous, B, intramuscular, C, orally, or D, IV pump? And the answer is C, orally. And those are going to be my references.